This is the first boot camp of the year and the largest class of new nurses at Rady Children's Hospital. Educators are a critical part of training so hospitals can recruit more nurses to address the shortage. This group of registered nurses at Rady Children's Hospital is made up of second career nurses and new grads with a passion for taking care of kids.
I was put here to help give back and do something greater than myself.
Julia Wood knew since she was a child this was meant for her.
My best friend growing up had cancer, and I went with him to a couple of his treatments, and seeing the way that the nurses interacted with him really made me want to be able to do the same and give back.
Her colleague Cassidy Lane also knew this was her calling.
I always knew that I wanted to help people.
Cassidy and Julia already graduated from nursing school, but to treat young patients at Rady Children's, they need to go through intense boot camp.
Pediatric, the back is going right on the back.
And it's not just little adults. They're completely different. The nursing skills are different. The equipment, the supplies that we use are all different. The feel of putting in a PIV is completely different on a newborn baby than it is on an adult.
47 pediatric nurses are going through the boot camp.
This is actually our largest cohort that we've ever had.
The hospital says it has 2,000 nurses, but more pediatric nurses are needed. The U.S. Bureau of Labor Statistics projects more than 250,000 additional nurses will be needed by 2030.
Between our brand new nurses and our experienced nurses, just in the last few months, we've hired close to 90 nurses.
It's educators like Jessica Applegate that are essential to recruiting nurses. The National Institute of Health reports one of the many reasons for the nursing shortage is due to the lack of potential educators.
We need tons of nurses, and that's not just something that's unique to our organization. This is a nationwide crisis.
A crisis that these pediatric nurses are eager to address.
I just can't wait to actually meet my patients, and I can't wait to have an impact on them and their families as well.
Throughout this year-long training, the new pediatric nurses will be weaned off their mentors and eventually be released to treat patients on their own.